The year is 2028. Antimicrobial resistance has reached 52%. What does that mean? It means that more than half of all infections humanity faces are no longer treatable with existing antibiotics. We've crossed the point of no return. But here's what they won't tell you. We're not unprepared because we lack resources. We're unprepared because we're asking the wrong questions. I'm Dr. Kadiyali Srivatsa. I've spent years caring for critically ill patients, watching infections ravage bodies while bureaucrats debate equitable access in air-conditioned conference rooms. The WHO has pandemic agreements, beautiful documents, glossy brochures about pathogen sharing systems and coordinated supply chains. But when a new pathogen emerges, when symptoms we've never seen before start appearing, what good is sharing a pathogen if no one knows what to look for? COVID-19 taught us this lesson the hard way. Loss of taste and smell wasn't recognized as a symptom until almost a year into the pandemic. How many lives were lost because we waited for lab confirmation instead of recognizing patterns? The current system is built on academic idealism, not clinical reality. Decision makers who've never held a dying patient's hand are designing our pandemic response. And it's killing us. Right now, antimicrobial resistance sits at 42%. In 2028, just 3 years from now, it will hit 52%. That's not a statistic. That's a death sentence for millions. When AMR crosses 50%, the mathematics of infection control collapses. You cannot contain what you cannot treat. Routine surgeries become life-threatening. Childbirth becomes dangerous. A simple cut could kill you. And we have no system in place to catch these infections early before they spread or kill. The world talks about coordinated response, but coordination requires recognition. How do you coordinate a response to symptoms you don't recognize? Current medical AI systems use algorithmic decision trees. They ask, do you have a fever? Do you have a cough? They follow rigid pathways designed for diseases we already know. But emerging infections and antimicrobial resistant strains don't follow our playbooks. They present with novel symptom combinations. They confuse even experienced doctors. So we wait, we test, we refer. We watch patients deteriorate while the system catches up. By the time we identify the pathogen, it has already spread. From one patient to a family, from a family to a community, from a community to the world. The pandemic agreement talks about international solidarity. But solidarity is meaningless without immediate, intelligent triage at the first point of contact. This is why I created Dr. Maya AI. Dr. Maya doesn't follow algorithmic decision trees. It uses color-coded pattern recognition, the same clinical reasoning process a junior doctor uses when they see a patient for the first time. Here's how it works. Red symptoms requiring immediate doctor's attention, yellow self-diagnosis, and managed with the help of a chemist or pharmacist. Green symptoms manageable by nurse triad or NHS 111 in the UK. Blues are infected, so isolate at home. Help identify clusters of infected individuals. But here's what makes it revolutionary. Dr. Maya recognizes combinations. A fever alone might be green. A rash alone might be green. But fever plus rash plus headache in a specific pattern? That becomes yellow or red. This is clinical pattern recognition, not algorithm following. When a new pathogen emerges, when we see symptom combinations we've never seen before, Dr. Maya can flag them as unusual patterns requiring urgent investigation. It doesn't need to know the disease. It just needs to recognize, this is different. This is spreading. This needs attention now. Dr. Maya AI is available 24/7 in multiple languages and accessible via a smartphone app or the web at call111.com. It doesn't replace doctors. It empowers people to be their own first responders. A mother in rural India sees her child with unusual symptoms. She doesn't need to travel 50 kilometers to a clinic. She doesn't need to wait days for an appointment. She opens Dr. Maya, describes the symptoms, and immediately knows, this is red. I need help now. A teenager in Nigeria notices symptoms he's embarrassed to discuss. Dr. Maya gives him private, immediate guidance without judgment. A healthcare worker in an overwhelmed emergency room uses Dr. Maya to triage dozens of patients simultaneously, ensuring those at highest risk get care first. This is how we prevent the next pandemic, not with international agreements, but with intelligent, immediate triage in every home, every village, every city on Earth. Here's the uncomfortable truth: governments and global health organizations won't solve this. They will create more committees, more frameworks, more glossy brochures about equity and access. But when 2028 arrives and AMR hits 52%, you will not have time to wait for international coordination. You will need a tool that works right now, in your hand, in your language, with your symptoms. We are 3 years away from a healthcare collapse that will make COVID look like a rehearsal. You can wait for governments to act. You can hope the WHO's pandemic agreement gets ratified. You can trust that pathogen sharing systems will somehow detect the next outbreak in time. Or you can download Dr. Maya AI today. Because when AMR reaches 52%, the only question that will matter is, did I recognize the danger in time? Yes, because I've spent time researching the system, preparation in 2028 won't be an option. It will be survival. Dr. Maya is not an app one created to monetize, nor did I think this would help prevent pandemics. It is a system that will systemize healthcare, reduce disparities, and help protect healthcare workers and humanity. Trust me, I created Maya to help protect my family and my life, and never thought this would revolutionize healthcare until ChatGPT said that when I created Dr. Maya GPT.
The 2028 crisis is coming. The only choice is whether we meet it with integrated intelligence or fragmented chaos. The clock is running. What will you choose?